The exam boards state that you also have to know a non-biological explanation of schizophrenia. So we're going to look at the social explanation for schizophrenia. You need to be able to describe and evaluate this explanation and be prepared for comparing questions across against the two biological explanations. There is evidence that people in the lowest social classes and groups, such as immigrants, have a higher incidence of schizophrenia than others in the UK. It may be that social class is either a cause of schizophrenia or at least involved in the development of the disorder. In the UK, an incidence of above 4 people per 1,000 has been found, both in the lowest social class and the white population, and in the black immigrant groups. Those in lower classes also experience a different course in the disorder and receive different medical care. Official statistic and census figures confirm these differences. Lower class patients are more likely to be brought to get medical help by the police or by social services, and therefore for it to become compulsory and become compulsory admitted and to become long-term cases. In the 1960s, it was thought that lower class was a causal factor in schizophrenia, and this was known as the environmental breeder hypothesis. It could be that those with schizophrenia become lower class because they have difficulties that they face from the disorder. One study, using official statistics, found that those schizophrenic men were more in the lower classes, generally their fathers were not. Those that had developed schizophrenia had not done well in their education as children, and they developed problems in adolescence and had difficulty keeping a job. This is also known as the social drift hypothesis. Now, with regard to schizophrenia, it's widely accepted. However, more recently, studies have indicated that there may also be an environmental cause for schizophrenia. Although environmental factors are not likely to be the main cause, there is still an increase in the likelihood of developing the disorder. There is more association with schizophrenia in cities than in rural communities. Eaton et al. From 2000 has suggested that some aspect of city life may lead to developing schizophrenia. The social drift hypothesis does not fully explain the development of schizophrenia because there are lower classes in rural areas as well, and this doesn't explain the country to city split. Harrison et al. In 2001 found clusterings of schizophrenia in declining inner city areas, so perhaps being brought up in such areas leads to schizophrenia. Hajem et al. In 2004 showed that social adversity or social hardship in childhood relates to the development of schizophrenia later in life. In the UK, census data has consistently shown a higher incidence of schizophrenia in the Afro-Caribbean and black immigrant population. Estimates suggest that there are 4 times as many incidences of schizophrenia in these populations than in the white native population. Black immigrants in lower classes can't have suffered social drift either because they've always been in the lower classes. There are several reasons why the higher incidence of schizophrenia in the black immigrant population is not thought to be genetic. The risk of schizophrenia is greater, not only for African Caribbean immigrants, but also for African-born black immigrants and to an extent Asian immigrants. In Caribbean countries, the incidence of schizophrenia is similar to that of the native UK population and much lower than for immigrants to the UK. The rate for second-generation African Caribbean immigrants is higher than for first-generation immigrants. It isn't thought that the immigrants who came to the UK in the 50s and 60s had any mental health issues. In fact, they're thought to have been upwardly striving individuals. African Caribbean people with schizophrenia are likely to be unemployed, living in poor inner city areas and in a worse situation than other African Caribbean people. They're more likely to be living alone and to have been separated from their parents when they were younger. Therefore, the features in the environment that appear to affect the development of schizophrenia are adversity in adult life, unemployment and poverty, social isolation, living in inner city areas with poor overcrowded accommodation, high levels of crime and drug use, and then separation from parents as a child. You need to be able to evaluate this explanation. Now, it's hard to separate environmental factors to see if they cause schizophrenia. They could be a result of the disorder, as the social drift hypothesis suggests. Not everyone with certain environmental circumstances develops schizophrenia, although there may be environmental triggers. Other causes may be possible, such as genetics and neurotransmitter functioning, and it may be that both of these explanations are possible and are capable of coexisting together. Those in lower socioeconomic groups living alone, unemployed, and living in poverty might be more likely to be diagnosed with schizophrenia, suggesting a diagnosis problem, not an environmental problem. It might be that poverty, unemployment and lack of social support are stressors, and it may be this stress that causes schizophrenia and not the environment. The idea does help to explain the fact that although there are more people with schizophrenia in the lower classes, they are concentrated in inner city areas, and that black immigrants are more likely to be diagnosed with the disorder than white lower class groups. The environmental breeder hypothesis does explain these concepts better than social drift.